Welcome, everyone. I hope you can all hear me. So welcome to the first ever event for your cohort. It's about climate change and environmental health in Global One Health. And so this is a webinar jam. I don't know if you're familiar with this platform, but once we are at the Q&A, you can use the speak button. It's like this on the right to be invited as a presenter as well. So we can kind of interact more during the Q&A and we can see you and you can ask your questions and everything. So yeah, let's start. So there's a bit of background to this story, and Jouke will elaborate more on this because these events are organized for your cohort. And yeah, go ahead.
Thank you, Michu, and welcome everybody to this very first webinar of a short series. Thank you to Michu and to Jackie for organizing this and getting this going. And thank you for our two speakers who will be introduced shortly, already on your screen. Just a tiny bit of background, and I won't bore you too much with the details, but you may realize that it's been a while since we've seen each other. We saw each other in Rome for the World Food Forum flagship event. And it's been a while, so I have to admit, we've had a very slow start. And the very simple reason for this is that, to be very honest, we didn't realize the value of this cohort that we now have with you until we actually met you in Rome. And we realized we wanted to organize some more networking and some more knowledge exchange and some capacity building, but also the opportunity to learn from each other for you. And I'm very happy that Michu and Jackie are helping me with this. So welcome again at this very first session. And I just wanted to very briefly touch on, you'll see some Youth Food Lab branding on your screen and maybe in some of the communications that you receive as well. And it might be nice for you to know that the Youth Food Lab is an additional initiative that Wageningen University has together with the World Food Forum. And they have adopted us, so the Global One Health cohort, the prize winners, you, as their research track. So we're now also part of the research track of the Youth Food Lab, which will explain why you see some of that branding as well. And that will also mean that potentially in the future, there might be some shared events and some shared activities with them as well, if you're interested. And we'll try to pick the ones for you, the events that the Youth Food Lab organizes that would be of interest to you too. So this very first event was organized at relatively short notice, and I'm very happy that we're all here. We will record the session, and Michu will probably talk a bit more about that, so that even the people that couldn't make it will still be able to benefit from this session. As I already indicated, we're going to do a series of these types of webinars, and we'll share the dates and the topics of those with you as we go. Back to Michu, I think, and then enjoy this nice and very interesting webinar. Thank you.
Yeah, thanks for the explanation. So, like Jouke said, the session will be recorded. We'll try to do that with future events as well. And then we can, put it online and you can watch it back later in the case of a webinar. And I mean, in the case of interaction, it's of course easier if you're present because then you can directly ask your questions to the speakers and everything. So yeah, we wanted to build this online community for you all to interact and facilitate this knowledge exchange. And we hope you can learn a lot during our events. So for today's schedule, the first presentation will be by Katarina from FAO, and she will explain about her work and about her work as climate change consultant. Then we have the Q&A, and then we have a short break to allow you to get some coffee, go to the toilet, get some snacks, and then we have this second presentation by Christina, and after that the same Q&A. And at the end, we would like to have a feedback session with you, the cohort, to really see what you got from this session and what you kind of would expect from future events. So like I said, we first have Caterina Anghioni. She's working from Italy for the FAO as a climate change consultant. And I will not spoil you too much about the speakers because of course they have their whole presentation and everything. And the second speaker is Christina Russell. She's a senior scientist at the International Livestock Research Institute at Kenya. And yeah, same here. I won't spoil you too much. So I hope you all enjoy these events. We kind of scheduled quite some time for the introduction to allow people to drop in. But yeah, let me see. I think, yeah, part of you are already present. So I think we can just start with the first presentation and people can always drop in later. So yeah, the floor is all yours.
Thank you so much. Thanks for the introduction, and thanks again for having me as a speaker. It's a really great pleasure and an honor. I think it's a really exciting project to be part of. So yeah, I'm Caterina Anghioni. I'm originally German, but I'm based here in Rome, in Italy. I work for FAO headquarters in the Office of Climate Change, Biodiversity and the Environment as a climate change expert. And yeah, today I'm going to talk to you about climate change and environmental health, but from an agri-food systems perspective. So just to give you a quick overview of what I'm going to cover. So I'm going to talk a little bit about, the institutional background of FAO, FAO and climate change, but also FAO and health. And then to make it a bit more technical, I'm going to introduce you to how climate change impacts agri-food systems and their health. And we're going to have a look at three different components, if you want, right? We're going to look at the environmental health, because I guess this is the principal topic of this session. But I also want to touch on producer health and also consumer health. So we're going to kind of walk along an agri-food system, if you want. We're also going to have a look at what FAO is doing, right? So FAO's solution to climate change problems in relation to health. We're going to have a look at FAO's One Health approach. We're going to have a look at building resilience and adaptive capacity with regard to climate change, and capacity building and knowledge sharing as part of a solution that FAO offers. I'm going to give you a little conclusion in the end, and also a slide with some resources that might be useful for some of you. So let's get started. FAO. So FAO is the Food and Agriculture Organization of the United Nations, as you might know. It has the headquarters here in Rome. And it was really nice to hear that actually some of you have been here. So you probably have a picture in your head. So FAO is basically dedicated to addressing all the global issues that are related to food production, agriculture, rural development, and basically everything that has to do with food. And so its overall objective or mandate is to provide food security for all, right? And make sure that people have access to high quality food that allows them to live an active and healthy life. And we do that by helping governments and also development agencies to coordinate and improve everything around agriculture, forestry, fisheries, so agricultural sectors, in order to achieve, basically in the end, the Agenda 2030 and the SDGs, right? And make agri-food systems more efficient, but also more inclusive, more resilient, and more sustainable in the long run. And we are guided by what we call our 4 betters. So it's these 4 key objectives of better production, better nutrition, better environment, and better life. And all of these while leaving no one behind. So FAO and climate change. So with climate change becoming more and more important, right? More and more noticeable, like nobody can deny it's here. We're all experiencing it. Of course, it's also becoming super important for FAO, right? Because, I mean, we work with food producers, we work in food systems with primary resources and ecosystems. So climate change is huge for us. And in response to the more and more noticeable climate change impacts, FAO has developed this strategic framework that is basically just a plan that outlines how FAO is looking to promote sustainability in agri-food system, right? And actually make food production part of the climate solution instead of a contributor to climate change, as it is still often the case. And in line with this strategic framework, so the overall guiding principles, basically, we also developed this strategy on climate change and the action plan that goes with it. So basically the plan that implements the strategy. And this is basically just looking at climate change in a more focused way. And it outlines how FAO is looking to support countries in becoming more climate resilient and adapted. So FAO and health, I think the slides are a little bit moved, but it's fine. So the heading is a bit cut off. But FAO and health, so in the latest IPCC report, it very clearly says that health is becoming a huge factor when we talk about climate change, right? And we have to think connectedly about health, agri-food systems, food production, and climate change. And basically, we have this nutrition strategy that FAO came up with in response to this, to the fact that health is becoming a big topic, also in relation to climate change. And this strategy, it outlines how FAO is going to enhance healthy diets and what FAO is going to do to improve food safety around the world. So lots of strategies and frameworks, but basically what we can take away from this is that FAO is really aiming to build climate change resilience on the one hand, obviously among food producers and rural communities, but is also looking more and more at health-related issues that arise because of climate change. So for example, malnutrition, polluted foods, food scarcity, and of course, many, many more that we're going to have a look at now. So to become a little bit more technical, finally, so how does climate change actually impact agri-food systems and their health? And so I gave you like a little bit of a recap, maybe, because I'm assuming that the whole climate change topics is probably old news to most of you. But just to summarize again, the impact of climate change on agri-food systems in particular. So what we can say with high confidence is that all food production systems, no matter whether it's crops, it's livestock, it's marine systems, fisheries, all food production systems are impacted by climate change and undermined, so negatively impacted by climate change. And they will continue to be impacted in the future, right? And so, especially in the past 50 years, we have experienced what we call food production shocks. So basically, it's climate hazards that really put, a stop to food production or cause like major food losses. And the primary sources of these food shocks are most notably droughts, heat waves, floods, storms, and pests and diseases that break out related to these factors. Of course, we also have rapid changes in weather patterns that put like strains on not just the resources and the ecosystems, but also the socioeconomic factors, right? So financial strains, value chain disruption, and et cetera, et cetera. So basically what we can summarize, or what our starting point is that climate change has an impact on every aspect of the agri-food systems and productive ecosystems, right? It's impacting producers, rural communities, but also the consumers and all the components along an agricultural value chain. And so to break it down a little bit, and like give us a starting point, because agri-food systems are very complex, right? I tried to narrow it down a little bit. So this is very simplified, and in reality, it's much more complex than that. But I want to start by looking at the actual environmental health, the topic of our session. And by environmental health and agri-food systems, I mean the resources, right? So the primary matter, the ecosystem services, and all the natural resources that we need for food production. And then I want to look at the producer health as well, right? Because we cannot look at agri-food systems in food production without the farmers, the fishers, the pastoralists, and all the other people and stakeholders involved. And finally, as kind of like the last component of a value chain of an agri-food systems, we also have to look at the consumer health, right? So we have to look at the final product that in the end we have from an agricultural system. And so we want to have a look at food safety and food security. So this will kind of guide us through this technical part. So to start, environmental health. Climate change impacts environmental health and agri-food systems immensely, right? We have extreme heat, we have increased droughts that put a strain on production, especially in crops and animal productivity. It impacts soil fertility, it causes land degradation, increasing temperatures and precipitation changes. You know, they cause shifts in growing cycles in crops, but also cause pests and diseases, especially in livestock, and many more. In marine systems, we have to battle rising ocean temperatures, right? We have marine heat waves. We have ocean acidity that, of course, impact, the marine ecosystems and all the processes that eventually leads to reduced resources in coastal ecosystems, right? The reduced availability of fish, but also other services that these ecosystems provide. We also have an increased number of extreme weather events, such as cyclones, floods, fires as well, that cause direct disruption and crop damage, so direct yield loss. But also, as an indirect consequence, they also foster the emergence of pests and diseases, right? So this is also something to consider, and not just the immediate destruction. We also have an increased atmospheric CO2 concentration. And I know that here argued whether this might not also have a good impact on food production, because, higher CO2 concentration means more photosynthesis, and therefore, more plant growth, right? But what we can also say is that the increase in plant biomass and plant sugar due to the higher photosynthesis rates is also benefiting pests and also benefiting weeds, right? So again, a negative impact here. So what we can say is that the environmental health and the ecosystemic health in agri-food systems is suffering a lot, right? And this basically leads to ecosystem services and the resources that we need for food production are diminishing and they are declining. And so this is basically the takeaway from this, right? Climate change is reducing environmental health in agri-food systems. Let's have a look at the producer health. So basically the second part of our agri-food system, right? What we can say here is that climate change definitely also impacts the producer's health. So we have testimony that heat stress events and also droughts, they impact physical labor productivity. People that work on the field, they suffer a lot from increased heat. I don't know how it's in the Netherlands, but I can tell you heat stress already here, not just in the field, it's a very real thing. I don't know if you were in Rome in the summer. I survived it last year and it was horrible. So, but of course, we're talking about farmers here. So what we can say is that farmers in rural communities working outdoors, of course, have a higher likelihood of heat exhaustion, but also not just heat exhaustion and heat stress, but also they are at higher risk of catching vector-borne and diarrheal diseases due to climate change. And so what we can say is that farmers are particularly vulnerable, right? They suffer a disproportionate portion of these effects because they are very highly exposed to these hazardous conditions. And this actually means that supply and productivity will decrease an estimate between 2 and 14% just because of reduced labor productivity caused by heat stress. So this is something to keep in mind. So 14% is a lot for just heat stress due to labor productivity, But another aspect that we have to have a look at if you look at the producer, and I think this is often a bit maybe neglected or seen as not as important as the physical aspects, but what we also have to look at is the mental health, right? So what we can say is that climate change strains the mental health of agriculture-dependent communities and especially smallholder farmers extremely. I know that farmers around the world are not really happy anywhere, right? I mean, in the Netherlands is a really big topic. I grew up in Germany, so farmers are protesting as well. Here in Italy, there have been protests like just a couple of weeks ago. So it's pressuring farmers everywhere, but of course, smallholder farmers in developing countries that don't really have the means to balance off climate change impact, they are particularly affected, right? Because their livelihoods are at stake basically every day. And so there are studies that are saying that in India, for example, climate change may have contributed to the suicides of nearly 60,000 farmers just in the past 3 decades. So I think this is a very significant number that we need to take the time to look at and to recognize. I found another study that I linked you here that says that in coastal Bangladesh areas where cyclones are an issue, farmers are suffering from a whole range of mental health issues, right? We have depression, anxiety, suicidal ideation, PTSD, and so on and so forth. So this is definitely something that we have to keep in mind, right? And that we cannot ignore. But for now, let's move on to the consumer health. So basically our last part in the value chain or in the agri-food systems components. So what we can say here is that climate change also negatively impacts food security, food safety, and nutrition, right? We have warmer and more humid conditions. That's perfect for food pests. Food decays and goes bad more quickly. We have fungi and bacteria that feel very well on these conditions and might cause toxic compounds in our food. The atmospheric CO2 that I mentioned earlier might reduce the nutritional quality, especially on crops, because of the heightened sugar. But also, things like increased rainfall that can cause, runoff from soils might wash heavy metals and other toxins into our drinking water systems and into our soils. We have emerging zoonoses, so animal diseases that can infect humans. And of course, alterations in the distribution of vectors and other parasites, right? Pathogens that cause us to be sick, basically. We also have incidences of flooding, basically, that can lead to waste and other chemical products being washed into other areas of ecosystems. For example, when a farm is inundated that uses antibiotics, the antibiotics get washed away, and this can cause to the spread of antibiotic-resistant bacteria. And then we have this vicious cycle of, resistant bacteria that needs a different pesticide that becomes resistant, and so on and so forth. And of course, we also have these extreme weather events that I mentioned before, right? That are very beneficial for diseases and outbreaks, but also simply disrupt the value chains and simply result in supply shortages. So basically what we can say is that these effects that I mentioned, they all contribute to essentially malnutrition and undernourishment in the end, right? And this is especially important or especially grave for vulnerable people, elderly, women, marginalized communities, children. And FAO has this State of the Food Security and Nutrition in the World report that it produces every 2 years. So the latest was 2023. And in there, it also focused on, the health aspects of climate change and other impacts that climate change has on nutrition and food safety. And basically what it says in essence is that climate change is pushing us off track of meeting SDG 2, right? The ending the hunger target. So zero hunger, SDG 2, and basically also FAO's mandate is jeopardized by climate change. So we really need to act. And how do we act? So what can we do? As FAO, so as Food and Agriculture Organization, of course, as I mentioned before, we have to tackle climate change as well, right? So we have to build resilience among the producers and other communities that are affected. But we also really need to focus on these health issues that are arising as a consequence of climate change, right? As I mentioned before, malnutrition, contaminated foods, food scarcity, disrupted supply chains, etc., etc., etc. So one approach that FAO is taking, for example, to tackle exactly this nexus of climate change and health is the One Health approach that I think that you are probably familiar with, but just to recap again, in the context of agri-food systems, this means that every component of the system, or the health of every component of the systems, be it humans, be it domestic animals, be it wild animals, be it ecosystems, crops, plants, etc., their health has to be looked at interconnectedly. So we cannot look at just the producer's health, right? This is why I included the consumers and the producers in this presentation, even though the focus is on environment, right? But we cannot look at just one component. It's just not sufficient. So we have to have this One Health approach in order to make agri-food systems transformative, to really transform them to become more resilient and adaptive to climate change. And ultimately also to reach the SDGs, right? So if we don't employ this One Health approach, we will not be able to meet the SDGs, especially not SDG 1, SDG 2, and also not SDG 13, the climate action. So how is FAO managing this One Health approach? So in FAO, this One Health approach is coordinated by this beautiful quadripartite collaboration. Is basically a partnership which includes FAO, but also UNEP, the World Health Organization, and the World Organization for Animal Health. And they work in various forms, right? I just listed some examples here. So for example, this quadripartite collaboration has a special working group with expert meetings to develop guidelines for control of pests and diseases with a focus on livestock and crops. It supports member countries and institutions in research and development. For example, pandemic prevention, early warning systems, especially for livestock diseases, strengthening human resources, public health, capacities. But they also develop concrete strategies, like briefing materials that contain strategies and possible actions that are directly aimed at policy and decision makers in the countries. So concrete action that we suggest that the countries could be taking. But we also, and this is also, for me at least, I'm not super interested in the finance topics, but nevertheless super important, we also mobilize sustainable investment into health improvement. And I'm going to give you an example of what that can look like. So this is the pandemic fund, is an example of how we mobilize investment into health approaches in agri-food systems. And it's hosted by the World Bank and basically is a multilateral financing mechanism, right? That is basically dedicated to paying grants to low income countries, developing countries, that they can then use to prepare for future pandemics. So this is kind of COVID inspired, but translated into agri-food systems. And so FAO is currently leading 12 projects that are implemented through this fund with a budget that is quite significant of 264 million. And actually over 30% of these grants go to sub-Saharan Africa. And yeah, as I said, it's basically projects that strengthen disease surveillance, early warning systems, and other aspects around pandemics. I put you some examples of a couple of initiatives here. If you follow the link, I assume that the slides will be shared. You can see the full list of the projects in more detail, what we can do. So another solution, so moving on from the One Health approach, right? Another solution that FAO, or another approach that FAO is really pursuing, is building resilience and adaptive capacity to climate change. So to make it super simple and not bombard you with boring definitions, basically what we can say is that the severity of climate change impacts on environmental health and agricultural productivity in food systems depends on the vulnerability on a country or an agri-food system, right? So I assume you know what vulnerability is, but simply like how much it hurts, to say it very in children's language. And the vulnerability, in turn, it depends on the system's resilience, right? And its ability to absorb the climate shock. So how well can a system deal with these impacts that we just heard about? And this resilience can be strengthened by improving the adaptive capacity to climate change of a system or a country. So basically, if we help countries or systems to adapt to climate change, the impacts will hurt them less. Very simple, again. This is not the professional language. But basically, this is the angle that FAO is taking, right? We aim to work at strengthening climate adaptation in the countries, in their agri-food systems. And FAO does that on a global or national level by looking at policies and helping countries to formulate and implement, for example, national adaptation plans. But also we promote concrete action on the ground with the farmers in the fields. And I'm going to give you 2 examples. So the first example is a project is called Strengthening Agricultural Adaptation, so the SAGA project, which is a global project that aims to reinforce adaptation planning. So it looks at the policy level in particular, and is working in Haiti and in Senegal, so two very vulnerable countries. And the activities that we support are both on local and on national level, and they are designed around these 4 components, right? So policy support, civil society, research, and dialogue. And again, I put here like a couple of examples for initiatives that the SAGA project is promoting and is supporting. And what is worth mentioning too is that in SAGA, especially, like multi-stakeholder engagement is a very important theme, right? So talking to the communities, co-creating with the farmers in the field to identify actions that then help national adaptation planning. The next example is the scaling up climate ambition on land use and agriculture through nationally determined contributions and national adaptation plans, the SCALA project. Sorry for this horrible name. This is the project I'm actually working on. So if you have any questions about that, don't hesitate. It's very complex, so I only scratched the surface here. But basically, it's a global project working in 12 countries in Asia, Latin America, and Africa. And what we do is we aim to translate the climate ambitions that countries have in the NDCs and NAPs, so their national climate policies and plans, basically, into concrete action in the ground. Again, with the ultimate aim to, make systems more sustainable and contributing to the SDGs. So basically, what we do is we talk with the governments of the countries to say, okay, what have you written in your plan, and how can we go into the field and make these commitments actually happen and produce some good results, right? And so I gave you a couple of examples here as well. In Ethiopia, where we work in watersheds, in Côte d'Ivoire, we look at financial mechanisms to reduce vulnerability. And in Uganda, we work in the cattle corridor together with pastoralists to identify climate adaptation actions that have transformative potential that we can then feed back into district planning, right? And like district level policies. So these were the 2 examples. And for all the FAO projects that work in this sphere, and generally for FAO projects, what is really important to highlight and to mention is that FAO is really keen on stressing the importance of community-based adaptation, right? Because adaptation actions or adaptation planning can only be efficient and can only be effective if local stakeholders are participating, right? So we have to co-create these actions. A random top-down approach of an adaptation action in an ecosystem, in an agri-food system, will not be effective, right? We have to make sure that we include include the farmers, include the dependent communities, include the ones that are affected, right? To make sure that the actions that we then implement are adapted to the local context and actually make sense. And we need to hear the voices of the farmers, right? So moving on from building resilience and adaptive capacity, another approach that is very important to FAO for providing solutions to the climate crisis and the health, climate change and food nexus, right, is capacity building and knowledge sharing. And I mean, I guess we all agree, since we are here doing exactly that. But FAO is really convinced, right, that sharing best practice examples, co-creating knowledge, building adaptation actions from lessons learned is really important. And so FAO has this learning approach with which is the farmer field schools, And it's basically it's building on locally led capacity buildings and trainings, right? It uses local knowledge systems and explores like learning techniques with farmers and other community members to strengthen them and empower them as well in decision-making capacities and action implementation. And it's one of FAO's main approaches or like main entry points to development support, to be honest. And it's been super successful, implemented in, I think, 100 countries so far, more or less, probably now it's more. And especially in Eastern and Western Africa, very successful. And now with climate change being so important, and not being, it's basically you cannot look at agri-food systems without looking at climate change. We also integrated this approach into the farmer field schools and having climate change enhanced farmer field schools, right, where the participants can learn around the background science of climate change and its impacts and how to actually tackle it in their systems. So to conclude all this, what you can take away, or what I hope that you take away from this talk, is basically that climate change impacts the health of all components of an agri-food systems, right? It's not just the environment, even though this is maybe the most evident, but it's also the producers, it's the community's health, it's also the products, of course, and the consumer's health that suffers, right? So again, we are mirroring this one health, that everything is interconnected. And basically, this puts us off track for reaching the SDGs, and particularly SDG 2, the ending the hunger SDG. So we really need to act, really need to tackle climate change and look at it from different interdisciplinary approaches. And to mitigate these effects, right, we need the One Health approach to recognize this interconnectedness. And we need to strengthen countries and communities in their adaptive capacity and resilience to climate change. So I know I have neglected the mitigation part here a little bit, but personally, I think that of course mitigation is important, climate change mitigation, and we shouldn't drop it altogether. But given that climate change has so far progressed, right, we really need to focus on adaptation and resilience, and all that we need to do, building on lessons learned and exchanging knowledge, exchanging best practices, etc. And then again, to keep in mind to have this as also an overarching principle is that climate action, whether it's in health, it's in environment, it's in any other part of an agri-food system, it must be inclusive. So it must include all the stakeholders, the farmers, the affected communities. It must aim to be transformative, so not just improving the agri-food system, but actually creating something new to really tackle the new challenges that we are facing. And it must be locally led, right, to meet the local context, to meet the local needs of the affected communities. And so just to give you a couple of resources as a giveaway, I really, really encourage you to have a look at the FAO Climate Change Knowledge Hub. It's a great resource. It's basically this interactive platform that FAO established. It has these 4 components that I so professionally screenshotted here on the slide. But you have some great e-learning courses around all the topics of climate change and agri-food systems and food production. That are easily accessible, they're for free. You can get certificates. So if any of what I talked to you about is of interest for you, I really encourage you to go to check it out. And I also put you the links to some projects that I mentioned and to some recent publications. The Catalyzing Climate Solutions publication is really interesting, to have a overview of what FAO is doing in climate change adaptation. So yeah, that's the end of my talk. Thank you very much for listening. I hope you enjoyed it. I hope you learned something new. And please feel free to reach out. I left my email address at the bottom of the slide. Please contact me, and of course ask your questions in the session following. Thank you so much.
Thanks a lot for your presentation, Katarina. I really loved going from describing the problems and then giving all the part of the solutions, and hopefully contributing to this in the future. So we already have a few questions actually. I hope I'm going in the right order, but I will invite Tigran to be a presenter. Let me see if this works. His question is how flooding and AMR development in the context of climate change could be associated, at least. So,
right. That's a good question. It's actually very complex. I touched on that, I think, just very briefly on one of the slides, right? So basically, flooding is becoming a problem. I mean, is a problem in either way, right? Not just in this context. But specifically in this context, flooding due to climate change. So, for example, an extreme weather event, let's say we have a cyclone, right, that causes flooding. If we have this flooding that occurs in an area or in an ecosystem or in a farming environment where farmers use pesticides and use, for example, antibiotics in animal farms, for example, if the flooding occurs there due to climate change, of course, the water kind of acts like a transport vehicle, like a transport mechanism, and that of course leads to the spread, leads to distribution of chemicals, of pesticides, of fertilizers too, that actually should not exit this farm, right? For example, antibiotics that are in theory supposed to be very locally applied, right, to the animals on the farm. But if we have the flood as a result of climate change, that then acts as a medium to transport these antibiotics into other ecosystems. For example, imagine you have a forest next to a swine farm, and the flood caused by climate change, it then transports these antibiotics, let's assume it's antibiotics, into the forest, right? And it then allows these antibiotics and also other chemicals to infiltrate other ecosystems, right? Where then these resistances can occur. So if you have these antibiotics, of course, I mean, it's not just a problem in other ecosystems, but also on farms themselves, right? The problem of the use is that it creates this cycle. It creates a cycle of, we can see that also in weeds very well, it creates this cycle of due to natural selection and basically just evolutionary mechanisms, the crops or the animals create the resistance to antibiotics. We also see that in vaccines, we see that in COVID, right? That the viruses, the pathogens become resistant because they develop. And then we have the cycle of having to use another antibiotic or another vaccine, if you want to stick with COVID, or another pesticide to combat this. And this kind of creates like a dependency, right? Because you always have to add more. You always have to go one step further once you have that resistance building up, right? And the problem of climate change coming into that is, of course, that the flood, as I used in this example, will basically just facilitate the spread. So you will have this resistance building and this response to your antibiotics or your pesticides, not only on your farm environment, which is already bad enough, but in a broader context. And also in a context that we don't know what the responses might be, right? So we don't know because we cannot really study what the impacts will be if an antibiotic that we developed for pigs or for chicken will infiltrate, for example, a marine ecosystem. We don't know what will be the impacts on these systems, right? On these networks. But yes, to make it short, like this was just to illustrate how climate change can facilitate the spread of these resistances, or like facilitate the spread of chemicals that shouldn't be spreading out into ecosystems that shouldn't be affected. Yep. I know that was a little bit spontaneously improvised, but I hope it answered your question. There's also other examples, right? If you look, for example, at algae blooms, when due to heavy rainfall, for example, pesticides and fertilizers are washed into lakes, into oceans, and then cause algae blooms that then cause, the food chains to disrupt and like ecosystems to kind of shift and being disrupted, basically. Floods is just an example. There could be many more, and also without extreme weather events, climate change facilitates that just by higher temperatures, by different rainfall patterns, right?
Yeah.
Not sure if that was clear.
Does it answer your question? Again, was that clear for you? Is it okay?
Thank you very much. Yes, thank you.
Yeah?
Thank you.
Okay, great.
Thank you.
Then I do need to go one by one because we can invite so many presenters. So I will remove Digin, if that's okay with you. Is your question fully answered? I think so. Okay, then we have another question from Enrico. He says, hi everyone, thanks a lot for the interesting insights. And I was wondering if the Scala projects involve only developing countries, and if somehow there is a connection with Coronivia joint work for agriculture, since we are talking about the NDCs. In case you want to interact more about that, Enrico, you can also request the permission to speak, but I will leave the question to Katarina for now.
Thank you. That's a really good question. So, okay, I see you are familiar with the topic. I wasn't sure how much into detail I can go with like NDCs and NAPs. Yeah, so Scala, for now, it works mostly in developing and in transitioning countries. So we have some low-income countries, but we also have, for example, Costa Rica, which is relatively developed, or let's say comparatively doing well. But yeah, the focus is definitely on developing countries, right? Because since the project idea is basically to scale up NAPs and NDCs, or to like translate or implement NAPs and NDCs, these are the countries that need the most support, right? Be it through financial mechanisms or simply technical support. And so Scala has three outcomes. I didn't put all of this on the slide because it would have just been too overwhelming. But basically, we work along three different targets. So target one is identifying transformative action in the ground, so in selected value chains in the countries, which we do through what we call systems level assessments. So we have a look at the value chains that we select, or that the countries select, and request our support. And then we identify, I think it was Uganda, the example that I mentioned, we try to identify how we can act, like where we can act, what we can do, right, to really make this transformative change happen. Then on the next level, basically, we have outcome 2, which looks at the concrete policy support, right? So it looks at the NAPs and the NDCs that we either implemented, that we helped formulating, that we helped integrate an agriculture focus. But we also look at things like monitoring and evaluation, right? We have a look at, is there an MRV system in place in the country reporting on agriculture, reporting on adaptation? And with this outcome, we also provide tools. We provide, all sorts of like technical support to assess the effectiveness of NAPs and NDCs, right? And then we have outcome 3, which looks at private sector. And so this is also, maybe relatively new in these development projects, that we look at how to engage the private sector to actually come in and invest in climate action, right? Invest in sustainable agriculture, invest in sustainable agribusinesses. So we try to mobilize that and help the countries get resources by that. And yeah, there's definitely linkages. There's definitely linkages with Coronivia. There's definitely linkages with Sharm el-Sheikh. So Scala builds on a project that is formerly, it was called NAP Ag, so National Adaptation Plans Agriculture. That worked very basically as a response to Coronivia, to basically implement agriculture into planning, right? Into climate planning, into NAPs, but also NDCs, of course. Hope that answered it.
Yeah, thank you for the explanation. I think it's very clear, and we'll see if he has any follow-ups on that. So the next question is, correcting climate issues, by Lencho, by the way, correcting climate issues could solve many problems, but it requires substantial effort. And how can we accomplish this more easily? And then Joukje adds that she was wondering something similar, like how can communities be positively engaged to focus on minimizing CC and also work on adaptation at the same time, while not being overwhelmed by feeling that the issues are, so much larger than just the own community can address.
Yeah, that's. I wish I could answer that question. I guess we all know the feeling of feeling overwhelmed, right, by the issue being so much larger. Like even here at FAO, like we are amongst ourselves, so I can speak very openly, right? I think we all know the feeling of not, or having the impression that we cannot do enough, right? I mean, because at the end of the day, we are individuals, right? And we are fighting a battle that nobody has fought before, right, in the history of humanity, and it's huge. And we have to do that under an immense time pressure, right? It's not just that we have to do that, we also have to do it quick and effective, right? And there's so much at stake. So I wish I could tell you what we can do, but I mean, what I can tell you is on the community level, right? I think, of course, what is important is capacity building. It's knowledge exchange. It's also fostering the exchange, not just from like the a bit old-fashioned model from north to south that we, I think, hear a lot about in like, you know, previous approaches or paradigms of development cooperation. But I think what is even more important is the South-South cooperation, right? Or triangular cooperation. So allowing communities to learn from each other and not just following this approach of, you know, us educated white people going there and showing them how it's done, right? That's not going to work. So it's really important to initiate this this basically desire from the communities themselves to implement action. And to be honest with you, usually that's not that hard. Like the communities themselves and the farmers, especially farmers and of course pastoralists and fisher folk, they are usually very, very aware of the issues that they are facing and the issues that they will be facing. And they are usually also very aware of what needs to be done, right? Because I think we underestimate like local knowledge, traditional knowledge, indigenous knowledge a lot, right? So if you go to a forestry dependent community in Colombia, for example, they know what to do, right? They know how their ecosystem works, so they know how their production system works, and they are of course interested in preserving that, right? They are interested in protecting that because their livelihoods depend on that, right? And they know what is at stake.
Yeah.
So I guess it's not that much the problem of engaging the communities or you know, convincing them that something needs to be done, but it's more like creating an enabling environment, right? In order for the communities to be able to act and to be able to implement their ideas, they need the support in terms of policy, they need the support in terms of finance, they need the support in terms of like technological supplies, for example, early warning systems, MRV systems, right? So it's as simple as that, right? They need the technology. And so I think if we go back to the Scala project, for example, this private sector component, which sounds a little bit boring, a little bit, you know, whatever, finance. But actually it's really important because if, for example, in a country where basically we have all the knowledge and we have a community that is active, that is engaged, that wants to implement climate action and that knows what to implement, but if the money is not there, then it's not going to work. So, and then if we as a global project, as FAO, as whatever research or you know, implementing organizations, we can somehow create mechanisms for the private sector in a country to invest and to actually be convinced that investing in climate action is profitable as well, right? We need to de-risk too, right? We cannot just say, hey, go invest, this is great. But we actually need to create incentives for investment, and we need to, you know, sell it if you want, that investing in climate change adaptation will be profitable, right? And I mean, there's numerous studies, there's numerous reports saying that the loss and damage that we have from climate change in agriculture is going to cost us so much more than simply investing, in climate action now, right? But we kind of need to make the pitch. We kind of need to show concrete de-risking mechanisms. So this could be one angle that you can take if you want to stick with the financing, right? And it's the same with, you know, the other things I mentioned, policy support or simply technological support. But to come back to your question, I don't think it's the communities that much. Of course, too, you know, sometimes there's simply a lack of knowledge or awareness, or, you know, very often what we also shouldn't neglect, it's also simply traditions that are being passed on, which is, to be honest, more a problem in developed countries, right? That unsustainable farming practices, for example, in Germany, in the Netherlands, in Italy, is being passed on from, I don't know, father to son, mother to daughter, and so on and so forth. I think it's not so much that there's no willingness, it's just that the environment on a bigger scale is not really allowing this transition. And I think this is where we need to, this is what we need to tackle, right? More than the actual communities. But at the end of the day, I do agree. I think we all feel overwhelmed. And that I unfortunately don't have an answer. Like I cannot tell you how to not feel overwhelmed.
No, I think that's a solid answer. I mean, I guess it's most important to really enable really integrating the local knowledge and then facilitating that through funds and everything.
Exactly.
I think it's a good answer. Yeah. Okay. I think we have to cut the Q&A. There's still hands raised and questions, but you said it's okay if they reach out to your emails.
Of course. Yeah, definitely.
So feel free to send her an email and discuss the ideas more. And thank you all. And thank you for your presentation and answering all the questions.
Thanks to you.
So let's go for a break. Maybe we take a bit of a longer break. So let's be back in a bit less than 10 minutes. So let's be back in 9 minutes. If that is okay. Thank you for the presentation. And see you in a few minutes, everyone. Hi all, good to have you back. So I invited Aurélie and Francesca as well as presenters. I saw they had their hand raised. Feel free to make your comments if you want. But in the meantime, I think we will slowly also get to the next presentation, which is the presentation by Christina. So we'll see. I don't have any notes yet that they are here as presenters. So I think we can just start with your presentation.
Okay. Thank you, Michu. Welcome back, everyone, from your break. I hope you got yourself some coffee or tea or snacks, as was suggested earlier. And I'm joining you today from near the equator in East Africa, from Nairobi in Kenya. My name is Christina Rösel. I was also born and raised in Germany, just like Katharina, but after vet school in Berlin, I joined ILRI 13 years ago, and I made my way from graduate fellow to senior scientist in the Animal and Human Health Program here at the International Livestock Research Institute. And I've been working mostly across Africa in Kenya, Uganda, Ethiopia, Malawi, Tanzania, Burkina Faso, Mali. So I've been in a few places, and it's a great place to work. So I press the next button, right? Yes. So my outline is a bit briefer than the presentation by Katharina. I want to introduce to you ILRI because I don't think ILRI is as known as the Food and Agricultural Organization at the United Nations. Then I want to talk a little bit about One Health research at ILRI. And then I want to talk a bit about environment health. So in the framework of One Health, where we always have this beautiful Venn diagram showing bubbles of similar sizes or circles of similar sizes depicting human health, animal health, and environment health, I want to bring you a few examples of the work that we do at ILRI and how we integrate environment health. But then I would like to hear from you. Are we just looking at environment health inside the One Health framework as a vehicle or a vector for infectious diseases or antimicrobial resistance, or should we give environment health a much bigger part and more importance in that One Health framework? So I would love to hear from you also, because of course I'm a vet, so I'm biased. So ILRI is short for International Livestock Research Institute, and it's one of 15 centers in the CGIAR. The CGIAR is a global partnership for food secure future, and basically what we do is agricultural research for development. So we work mostly in the Southern Hemisphere, as you can see from the map. Most of the centers are based in South America, Africa, or Southeast Asia. We have a biodiversity that is based in Italy, in Rome, and we have the International Food Policy Research Institute, IFPRI, that is based in Washington in the US. ILRI is in East Africa. We have 2 campuses in Ethiopia and in Kenya. Across the CGIAR, we have more than 8,000 scientists, researchers, technicians, and support staff. So it's also a big organization, but not quite as big as FAO or any of the UN organizations. ILRI is just one of these 15 centers and is the only of the 15 centers that works on livestock. Livestock meaning cows, sheep, goats, poultry. There's one other center working on fish, that's World Fish, but most of the others are working on plant crop commodities. So we have quite a unique position when it comes to animal health and zoonotic diseases. Livestock is very important to the global south and contributes about 40% of the gross domestic product in the whole world, not only in the global south, but at least 1.3 billion people depend on livestock for their livelihoods. And most of these smallholders, and they are even classified as poor, living off $1 to $2 a day. they are living in the global south. And these are the darker shaded areas on the map. And that's also, at least in Africa and Southeast Asia, where IRRI works. And our impact pathways are securing the assets of the poor, improving smallholder and pastoral productivity, and increasing market participation. So IRRI has about 600 staff located in 14 countries. And we're always happy to welcome students, undergraduates, graduates, and postgraduates. And I have even put a link at the end of the presentation. So if you're interested in joining IRRI for a little while, or to work, you're welcome to apply. Now, One Health, and the animations have gone issue, but that's fine. I hope people can follow my presentation without animations. One Health was an approach that was invented by vets. It comes from the veterinary discipline, because veterinarians, because of their training, they have always looked at animals as a food commodity, a resource that lives in proximity to humans, but especially also livestock that lives in the environment. And therefore, especially in the context of infectious diseases, the vets have been driving that approach. Conservationists that are more placed in the environment health circle of the Venn diagram, they have framed it conservation health, or ecosystem health, or eco-health. However, we were talking about similar thing. However, One Health is an approach. One Health is not a discipline, which is sometimes misunderstood. And since the pandemic, this word has become one of the new buzzwords, and I think many people have heard about One Health by now. And in the pandemic, it was also that the tripartite, formerly tripartite, was formed into the quadripartite. Katarina has already mentioned that. So the tripartite, and that's how you can tell this approach was driven by the vets, and in the context of infectious and zoonotic diseases. The tripartite was the FAO, the World Organization for Animal Health, or previously OIE, and the World Health Organization, WHO. But during the pandemic, UNEP also joined the group and has formed a One Health high-level expert panel. And thankfully, they have come up with a good definition of One Health, which we're now usually falling back on, because we have been arguing and fighting. What is One Health? Is One Health only where any of the two circles overlap, or do all of the circles in the Venn diagram have to overlap, or how do we define One Health? So in short, One Health is a multidisciplinary approach, but also a multisectorial approach, but it's about integrating different disciplines and different sectors, and trying to find synergies, mobilizing resources together, addressing problems together, and not trying to solve each problem on your own. So it's the power of partnership and walking the walk together. So the International Livestock Research Institute, I enjoy the setup of the programs because I think it represents One Health quite well. The 6 programs at IRRI, they're in these blue boxes at the low left side of the slides. So we have the animal and human health program. That's what I'm working in. And traditionally, we worked on East Coast fever and trypanosomiasis, which were very relevant parasitic diseases of livestock in Africa. So, but over the years, over the past 2 decades, we have also worked on zoonotic diseases, those diseases that can be transmitted from animals to humans. We are doing a lot of field epidemiology, studying zoonosis, including foodborne diseases, especially in informal markets in low and middle income countries. And recently also, we are working on antimicrobial resistance. We have another technical program that is looking into feed and forage development, feed and forage for livestock. So they're working on grass varieties that are drought resistant, but they're also working on grass or other fodders that increase the productivity of livestock. At the same time, now we are starting to work together on issues that are also climate sensitive, for example, mycotoxins, fungal diseases that, for example, get into the maize that is eaten by the cows and then reaches the milk and ends up in the consumer and can cause liver cancer. We have a program called Sustainable Livestock System that is working on climate change mitigation, not only adaptation, but also mitigation, and looking at rangeland management systems on better utilizing areas, regions in low and middle income countries that are not very suitable for crop production, but they're definitely very suitable grazing areas. But they're also looking at the impact of keeping livestock in these rangeland systems. We have a program called Livestock Genetics that is looking at preserving indigenous breeds, livestock breeds in Africa and Asia, but also trying to improve breeds or breeding for adapting them to climate change. Higher temperatures can cause a lot of heat stress in certain animal species. So that genetics team is doing a lot of work on that. And then we have overarching programs that are trying to now pull all these technical bits together and try and look at components such as equity, including gender, market access, but also how to deliver all this science to policymakers, and then maybe learn from each other. Uganda learning from Kenya, or Ethiopia learning from Burkina Faso. So they are trying to facilitate this South-South exchange that was also mentioned by Katarina before. However, we are just a research organization. That is our core business. We are not a development organization. However, the work we do, we want to reach a large number of beneficiaries. And because of that, we work with a lot of partners, through partners. We work through the governments. So I'm giving this example here of Kenya. We work through the Ministry of Agriculture, we work through the Ministry of Health and the Zoonotic Disease Unit that is spanning across the different departments, but we also work with the different county governments to reach the grassroots level, not just to stay at and talk at policy level. We work with the United Nations bodies. We work with the regional bodies in Africa, like the IBAR or Africa CDC. We work with the environment sector, not just Ministry of Environment, but also the Wildlife Service, Wildlife Training and Research Institutes, and global alliances on wildlife trade. So that is just an example for Kenya, but ILRI's approach to working is like that in most of the countries where we have operations. So coming back to my initial question and coming from an animal health perspective, I think it's very clear that the environment health is a driver for zoonotic diseases. I think Katarina has also given some really nice examples, including the question that was asked by Tegan on how floods can facilitate antimicrobial resistance. But actually, during the beginning of the pandemic, ILRI has partnered with UNEP, the United Nations Environment Programme, and studied the evidence that was there on spillover events and how to prevent the next pandemic. And that was just at the beginning of COVID. They've already started about learning lessons for a potential next pandemic. And they have identified 7 drivers of environment health that can facilitate spillover events and the rapid dissemination of zoonotic diseases across the globe. And actually, all 7 of them are anthropogenic. That means they are caused by humans, which is also a little bit disheartening, especially after the question on what can we do to stop this climate change, to stop global warming. All of these things are caused by humans, and not just climate change, but also the events or the environment that is made to facilitate pandemics such as COVID. So these 7 drivers, their increased demand for animal protein, that has to do with just a global population growth. I think we can all agree that we're at the capacity, the holding capacity, where a lot of people, and especially emerging economies, they are now also catching up and having a lot of people. Looking at Asia, for example, population growth has really taken up. And with increased income, which is one of the SDGs, that you want people to have more money and to have more nutritious food, the request or the demand for animal protein has also gone up. So people want to eat more meat. And this has also led to unsustainable agricultural intensification. I think that's a phenomenon that, especially if you are in Wageningen in Europe, I think this is a very visible phenomenon, monocultures, in crop production, but also in livestock production. We have an increased use and exploitation of wildlife. That includes trophy hunting, yes, but it also has to do with the increasing demand for animal protein and the increasing population, global population. There is, like bushmeat, for example, is seen as a delicacy in some areas, looking at West Africa, for example, or Central Africa, or also Southeast Asia. So the more people want to eat that delicacy, of course, the more wildlife is harvested for that purpose. And we're not judging, it's an observation. So there's also the unsustainable use of natural resources accelerated by urbanization, land use change, and extractive industries. And I'll show you a little figure illustration on the next slide. Global travel and transportation, of course, also facilitates the spread of zoonotic diseases. If you think of how fast you are traveling from Amsterdam Schiphol to Malaysia, for example, within a day you are there. And it's very, with this global air traffic, it is very fast to get from A to B and to cover very long distances that might be much shorter than the incubation time of diseases. Of course, we also have changes in food supply systems, whereas here where I am in East Africa, a lot of the food supply systems are very domestic. So people eating vegetables and meat that comes from within Kenya. Many of the high-income countries, they're importing tropical fruit. They're also importing beef from South America, and so the supply chains for food, especially, have become very global. And then climate change. I don't have to talk about climate change. I think we have heard from Katarina about this important topic, but this is largely anthropogenic. And the sad thing, I think, working here in the global south is that you see the farmers struggling with the effects of climate change that they have not created. And that is just an additional layer of inequity. So people have to now try and find ways of adapting to this climate change. They have to try and find ways of dealing with it. And yes, there's a lot of community knowledge, but climate change effects like sudden storms and floods or droughts, droughts maybe you can prepare for, but floods is very difficult to prepare for a flood. It's such a sudden event. So even community knowledge, can reach its limitations. However, that report, if you want to see it, if you want to read it in full, it's open access. You can download it, read it for free, and of course, work with it. So one of the examples I wanted to show you is how habitat loss and habitat fragmentation can lead to spillover of zoonotic diseases. So I think habitat fragmentation is something that has always occurred. And for example, we have the movement, tectonic movements. So islands have been created. If I think of Madagascar, Madagascar has a very different habitat than mainland Africa. So I think to some extent this has always been there, only that we humans, we sped up, we accelerated the process. And that is the same with antimicrobial resistance, because it was mentioned before, antimicrobial resistance is a part of evolution. It's always been there. But because we're using a lot of antibiotics and because we are using it in the wrong way and not prudently, that is why we're accelerating that evolutionary process of resistance. So habitat loss, I think that one is clear. Deforestation, poaching, all these things, they lead to loss in diversity of plants and animals. And this disturbance of these big habitats, they lead to generalists surviving. The generalists are the ones that don't react as sensitive to these disturbances by humans. They can quickly adapt. For example, there are some mosquito species. Now they're just looking at irrigation channels that were promoted in certain parts of East Africa. So they thought this is a really beautiful invention by development projects. Let's use these irrigation systems and breed. So that is where certain mosquito species transmitting Rift Valley fever, for example, they found a new habitat. So the generalists don't have a problem finding new living space. So these include the rodents, for example. These include the bats. These include certain birds and mosquitoes and ticks, for instance. So at the same time, what is happening, we have monocultures that I've already mentioned, both in livestock and in crops. And if you have a monoculture, that monoculture is very susceptible to a disease shocks. So it might be very productive, might have very high yields, but when you get a disease like, for example, influenza in exotic pig breeds, it wipes out the entire herd and there's not much you can do. But if you have a diversity both in mammals, but also within a species, then you are more resilient towards these disease shocks. So these things, they have really accelerated over the last century or 2 centuries, and they have led to spillover events or increased frequency of spillover events. You know, we've always had spillovers, but one thing was that spillover event might have never made it to the news, or the disease was so virulent that a person could not travel fast enough to the next healthcare center or to the next town and already died within a few hours. But now with, for example, anti-fever medication, you can mask symptoms for a while. With the global transport that I've mentioned, it's much easier to get the disease across the globe. So when COVID hit, I'm giving you another example from Kenya, which is supposed to illustrate how One Health as an approach can help quickly adapt to new problems. And here I'm still talking about a disease, but when COVID hit, the Kenya Ministry of Health, they had problems procuring primers, for example. There were not enough labs in the country. So the Ministry of Health, they went around and they accredited, or they first assessed the capacity of different labs to help doing molecular work to identify the variants that are hitting the country. And you remember we had the Delta variant, we had the Omicron variants, and the different variants, they informed the policy making, the decisions over lockdowns, how virulent, how dangerous, how mortal these variants were. So it was very important to know these variants. There were not enough labs in the country, so they also came to ILRI, which is an animal health lab, and they were very surprised that an animal health lab can run PCRs, can do genomic sequencing, and all these things. I think it was a really beautiful collaboration that I just wanted to highlight, because it's important to look over your normal sphere of influence. Look out for other opportunities to work together with colleagues that might not be from your discipline, but maybe they have similar approaches. And, you know, genomics doesn't care if it's a virus from animals or a virus from humans or a virus from plants. The approaches are similar. The same applies to the vaccines. Many people were asking, how is it possible that we came up with the mRNA vaccine that seems to help within just 1 year? It was not only 1 year, because in veterinary medicine, we have been using mRNA vaccines for many years already. So it was this looking beyond your discipline, consulting colleagues from other disciplines with similar technical areas and trying to find a solution together. So COVID is now disease X on the list of priority diseases for a potential with the next pandemic. Well, COVID is now number one, but before COVID, it was labeled as disease X. It was this unknown disease that could potentially cause a pandemic. But there are other diseases that can cause potentially another pandemic, mostly viral diseases, and ILRI is working on those that I highlighted yellow. And one of them is Rift Valley fever. I've already mentioned it before. So Rift Valley fever is a disease caused by an RNA virus, a segmented RNA virus that was first discovered in our beautiful Rift Valley, the Great Rift Valley here in Kenya, just north of Nairobi. So in that Rift Valley, there is a lot of crop production. There's a lot of livestock production, especially small ruminants and cattle. So, but also what lives in the Rift Valley fever are mosquitoes, especially Culex aedes species, but there are also other mosquitoes that are transmitting the virus. So usually what happens is we have a period of prolonged rains, more than usual, and that usually helps amplifying the mosquito vector. So the more and the longer the rains, you have like an explosion of mosquitoes. I think that's anyone who has been to Africa in the rainy season knows that, also to Asia and South America. So if, of course, these mosquitoes are now the Rift Valley fever vector and they carry the virus, they first start infecting livestock. And we notice that suddenly there is a lot of abortions, and especially sheep that are very susceptible to the disease, but also cattle. So that is usually when the farmers notice that something is off. There's abnormal high rates of abortions, which of course they have economic costs, but then when the farmer handles these aborted fetuses or tries to help the Huey or the cow, he might get infected getting in touch with these liquids. And then in humans, after a while, they can develop flu-like symptoms, but they're very severe diseases that we even call it the small sister of Ebola, because it can cause hemorrhagic fevers, it can cause blindness, it can cause encephalitis, and even death. So ILRI is doing a lot of work on this Rift Valley fever, just because we're in Kenya, but also because it's a disease we've been working on for long. The disease is now in many countries in East and Southern Africa, but also in the Arabian Peninsula. And it's one of the diseases that is listed as a potential next pandemic because it's very climate sensitive. We have the same mosquitoes in Europe. We have just done an infection study with the Friedrich Loeffler Institute in Germany, the Animal Health Research Institute. They have very, very controlled labs where no mosquito can get away, and they were infecting local mosquito species that you can find across Europe with Rift Valley fever, and they're just as competent in transmitting the virus as the African mosquito species. So with Rift Valley fever, apart from studying it in the lab, we are trying to pull all of this information together and creating what we call risk maps. So a policymaker does not care which primers you use in the lab. The policymaker also doesn't care exactly which mosquito subspecies is causing or is transmitting the disease. The policymaker wants to know where do I have to go and what do I have to do and how much will it cost me? So some of these maps, we are producing them for many diseases, and they use so many factors. They use, of course, the livestock densities. They use environmental factors, where we work with the Ministry of, or the Department of Meteorology in Kenya, trying to get data on precipitation, rainfall. We need to know which soil type is where in the country. So we know, okay, these are potential mosquito breeding sites. So there's a lot of different factors that go into a simple map like that. So, and then of course we have to adapt it with climate change. So right now in Kenya, we are really waiting for the short rains that are supposed to start in March and run for 6 weeks. And they're expected to be very heavy because of El Nino that's happening this year. So we're actually already anticipating Rift Valley fever outbreaks locally. At the same time, we are briefing the policymakers and tell them about the disease dynamics and what to be prepared for. We are talking with the communities, because the communities might not know, okay, this disease is called Rift Valley fever, but they know the signs and symptoms. They can tell you, oh, we had many more abortions this last rainy seasons than we had last year, for example. They can tell you about where to find the mosquitoes. They can tell you a lot about this local intelligence that needs to go into these maps. At the same time, you can also use this opportunity of course, you want to get knowledge from the communities, but you also want to give back knowledge. So you give back knowledge on when you see those signs, do this and that, protect yourself. If you think you are not going to get help from the government, like compensation for losses in animals or reporting diseases, it's a big barrier to farmers reporting some of these diseases. At least you know how to protect yourself and how to protect your dear ones. So these are very good synergies we are forming while doing our science, but at the same time working with the communities. Now, back to my question, and I hope that you're going to put your comments in the chat. I think we can all agree that, yes, environment health is a very important driver and vehicle and vector for infectious disease. But the environment, we all rely on the environment. And should we just look at the environment as something that we grow our food in, that we travel, that we admire, or should we just look at the environment as being an equitable aspect in our holistic being, and that also deserves being treated well? And the environment cannot talk our language, so it talks in languages like extreme changes of weather, for example, or soil erosion. So, but when we understand this language, it's often too late. So our programs here at ILRI, we are doing studies also on greenhouse gas emissions. That is something that informs even the International Panel for Climate Change, the IPCC. I put that last year's report in the chat earlier. You can read what are the current developments. You will see that COVID actually really helped reducing greenhouse gas emissions, because there was a total ban in global air traffic, which was fascinating to see. We can do it, but of course, after COVID, global travel picked up again. So we're back to where we were. So, but that IPCC also looks, for example, at emissions from agriculture, and often meat consumption is one of the things that are really stigmatized and blamed. But our scientists here in Africa, they're actually helping to generate more accurate data from the African rangeland systems, because there's no data. The data comes from high-income countries, where livestock is often kept in systems that are very different from African systems, for instance. They are in zero grazing units, very commercial, very intensive, whereas here we have a lot of grazing and rangeland components. So the net emissions of a rangeland systems are likely to be much lower than the net emissions from a zero grazing unit, for example, in the Netherlands or in Denmark. So our researchers are contributing with that data from Africa, and just a new publication from a colleague looked at the bomas. These are kraals, bomas, enclosures where the livestock is kept overnight, so they cannot be attacked by lions, for example. So these bomas, they are in no way a category in the IPCC report. So this is very interesting and contextual data. We also look at poop. So it's human feces, but also animal feces. And just like the bomas, of course, the manure is there and it's contributing to greenhouse gas emissions. But many of the farmers in Africa, they use manure as a fertilizer, organic fertilizer for their crops. And this is just to illustrate to you that any intervention has good things and has bad things. And for anything we do, we just have to look at what are the good effects and the bad effects. And using animal manure as a fertilizer is, of course, a super innovative and cheap approach. It's not even innovative because farmers have been doing it for centuries. So, but if you have a hybrid, a crossbreed, for example, an Ankole cow, that is an Ankole cow from Uganda, one with the beautiful long horns, and they have crossbred them with the Frisians from the Netherlands, just to increase the milk yields. But these crossbreeds are much more susceptible to tick-borne diseases, such as East Coast fever, for example. So the farmers have to put a lot of money and effort into treating them with acaricides to get rid of the ticks. But then also they use a lot of doxycycline, that's an antibiotic to treat the blood parasites. So not only do these things end up in the milk and in the meat, but they also end up in the manure. So if you bring out manure that has antibiotics, you're really impacting the soil biodiversity. And you can kill the worms in the soil, you can kill the little mites in the soil, you can kill the bugs, the ants, everything that keeps the soils aerated and suitable for crop production. But then, of course, we also have human poop. So, for example, the pig tapeworm, that's a disease that is can cause epilepsy in humans, but the problem is not eating the pork, but poor sanitation in humans. It's people doing open defecation, which is still a problem, and then ingesting the eggs of the worm. So, and it's actually not the pig to blame. And often we have this, when we work with communities, they say, yeah, we don't eat pork. But you don't have to eat pork to get the disease. You have to live in a community, in the village, where people eat pork and where the disease might be present. And then if people still practice open defecation, you might also be at risk, even if you don't eat pork. So that is one example to give you how environment is just much more than just diseases. It's about also giving back to the environment. It's about the responsible giving back to the environment, and to look at the pros and cons of any of these environmental interventions. And we just recently had an entire conference, so where we had a lot of debate. How should we even define, should we call it environment health? Should we call it environmental health? When we talk about the Venn diagram in One Health, then we talked about health is much more than just infectious diseases. It's also about mental health, for example. So the equivalent for animals would be animal welfare. What would be the equivalent to environment, the health of the environment? Then we talked about animal feeds and forages and the implications a poor environment health has on this farm to fork approach. We talked about soil health. I don't know. I learned that it takes 101,000 years to produce 1 centimeter of topsoil that is suitable for agricultural production. I was very stunned by that. So in the collection of presentations, you can listen to the soil health presentations. Very interesting. To what to what extent should we also include water health and the rangeland ecosystem management and solid waste management and many more. And I hope you are also going to give me some inspiration and maybe some challenging questions that as scientists can also think about how to give more credit to the circle on environment health in the One Health Venn diagram. So I also put a few additional resources in the slides. So the CGIAR has an open access policy. We want students to be able to read our papers and not to pay for subscriptions. I think when you're at Wageningen, you're very lucky. You will have access to a lot of papers, but there are also many other reports, the extension materials, there are books even from 40 years ago that you can find and download on CG Space. We have the ILRI One Health strategy, and we have more information on the different projects that work in One Health. That's the One Health Center in Africa at ILRI, ORECA. We have COHESA, Capacitating One Health in Eastern and Southern Africa, and we have the CGIAR initiative on One Health. And if you are interested in any opportunities to work with us for a little bit or longer, you can also sign up for updates. So with this, I also want to thank you. I sent Teni Sana, and my email is here. So you can also reach out if you want more information. With that, I hand back to Michu. I see there's been some activity in the chat, and I hope there are going to be some interesting questions.
Yeah, thanks a lot for your presentation. I think it was really interesting to get the perspective from both Katarina and you to, more from the climate change and the environmental health. It was very complimentary, so thank you. I have a question from Joukje. Should we use soil health as a starting point for better integrating environmental health? I tend to talk about ecosystems health and environmental health interchangeably. Probably also not very clear.
Yes, but it also, that comment or question shows the dilemma, because also everyone who works in research also knows it's a little bit territorial at times. So one discipline claims, we have invented this discipline, so we have to call it like that, you know. It's even like the vets came up with the One Health approach initially, but then the conservationists say, no, but we call it ecosystem health, we must call it this and not that. So often it's about a very a funny human behavior thing that are not even at all related to technical aspects. So it's really good to throw in all these terms, because then we can maybe work with that. And if also depending on which discipline we are talking to, we can maybe be a bit more flexible and adapt another jargon.
Yeah, so it's partly a matter of terminology rather than really the background behind it. Yeah. And then I have a question from Dencho. Although livestock farming impacts environmental health, humans are heavily reliant on animals. It would be beneficial to seek solutions. So, for example, biosecurity works. So I think it's more of a question like, how are you implementing biosecurity?
So, Lenshu, are you talking about high-income countries or low- and middle-income countries? I think these things are relevant to know the context. And, most of the teams are not based in the Netherlands. That's even better. Anyway, but I think it always depends on the context. And biosecurity is always important. But, for example, it's very difficult to talk to a pastoralist and tell the pastoralist with his 100 cow herd to implement foot baths, right? That could maybe prevent the spread of foot and mouth disease, just as one example. There might be many others. So you always have to look at the context. There's no silver bullet solutions for anything, but especially on, for example, antimicrobial resistance. Yes, biosecurity is very important. Better husbandry practices, of course, anything you can do to prevent even using antibiotics. But I think that's a lesson learned also from the global north. But anyway, sometimes it's the more convenient approach. And talking from a perspective in East Africa, you might want to convince farmers to use a vaccine, right? But that vaccine might not be available everywhere in the country. It might not be even on the local market, but then also it requires cold chain. So it's very difficult for us to get it to some of the more hotter and arid regions. So there's not always one solution for a problem, but it's always very contextualized.
Yeah, thank you for your answer. I also have Fatima in requesting to be a speaker. I just invited her, so I'm curious, maybe she has a question and she will come up as a presenter. If not, in the meantime, we can also first go to the question of Jackie. So environment is a potential health risk to most rural communities, especially in the context of small holder farmers. They usually forage for food or pasture in shared communal lands. This can potentially contribute to a disease. How would you advise farmers to handle this? I feel this is a trade-off to some of these communities.
Yeah, it's a very big problem. I agree, especially you are getting into the aspects of the livestock interface. Again, I'm here in Kenya, so I'll always use Kenya as the example. We had a very bad drought for 3 years until last year. So pastoralists, their animals were dying in large numbers. So they even took the animals into conservation areas like national parks and game reserves, even though they knew it was illegal. So they lost some of these animals due to lions and hyenas, but it was their only way of getting grass for their animals. And so ideally, if there was good preparation, you could, good forecast also and good government measures, you could tell the farmers, we are predicting the next 2 rainy seasons to fail. You should start destocking, for example. Sell some of your animals while they have good market value. Don't wait until they're very skinny. Nobody is going to buy a skinny cow, right? So start destocking. And so a lot of it has to do working together with the government, working together with the national parks. In Uganda, for example, some national parks, they open the borders or the gates to allow pastoralists to bring their animals into water points. This is not allowed in other parts of Africa. So there are different good examples from different countries on how the livestock and the wildlife can coexist. But it's getting harder and harder. And then plus we also have invasive plant species that are taking up space, and that cannot be eaten by animals. So there's a whole bunch of problems. So someone wanted to come online. I'm just looking at the time issue. I'm sorry.
No, of course. Yeah. I invited Fatima as a presenter as well. She can speak up if she will, or write her question in the chat. And otherwise, I'm wondering for the approach for like the farmers and the pastoralists. So would it be more beneficial to invest more in like these community conservancies over national parks that are really exclusive of local communities?
So that's also an interesting debate we're having with conservationists, because the national parks and fencing them is also a very European approach. So traditionally, there were no national parks in East Africa. There were just areas where you had elephants and wild antelopes, and then they coexisted with the pastoralists who would also graze their animals in these areas where the wild antelopes were. So, and this approach of creating conservation areas can also lead to fragmentation, as I showed on one of the slides, right? Because you are creating bubbles. So, but it's in this day and age also where you have a lot of pressure on the wildlife biodiversity, that is the only chance for some of these wild animal species to even not go into extinction. So, but it's handled differently in different countries. I've just visited Zimbabwe, for example. There was a great example of these transfrontier conservation areas that cross borders of different countries. They are massive protected areas, but they don't have fences. And they're working very hard with the communities on coexisting on this land and struggling together. So there's some really good examples also. Yeah, I hope that partly answers. There's never a silver bullet answer. That's the thing, you know.
I'm sorry, I was on mute. Yeah.
Yes, always contextual. Yes.
Yeah. No, it's. Thank you for your answer. I see in the meantime Fatima has also come online as a presenter. So if she wants to, she can ask her question.
There she is.
Okay. Thank you very much, Christina, for your presentation. When we talk about the context, or in the context of zoonosis, I'm always very much excited when I hear about zoonosis, because recently, or the report from WHO on neglected tropical disease, I know they were trying, or we were trying to eradicate most of these NTDs by 2025, but reports have suggested we cannot achieve that. And so a lot of researchers were wondering why some of these parasites are still persistent. And one of the reasons that have popped up is zoonosis. So when you take in the context of schistosomiasis, a lot of drugs has been given to communities, endemic communities and endemic countries, but the disease or the infection is still prevalent or is highly endemic. And so in the context of zoonosis, reports suggest that now there is a possibility of the livestock schistosome being transmitted to humans. So in the context of zoonosis, I think the One Health approach can be very well executed. So in this case, the human factor, the animal, and also the environment. So my question is, I don't know, I had this question for the, I think, Katarina from FAO, but I think let me ask, probably you might have an answer for me. If there is a well, documented, there is a document on zoonosis as an area to be specially tackled to help eradicate most of these parasitic infection, even in the context of climate change, environmental health, and all the other contributing factors. Thank you.
Thanks so much. It's a very important topic, neglected zoonotic diseases, especially because they are not causing a scare globally. They are not the viral diseases that make a lot of noise and kill people in the world. They are usually associated with poverty. And so they're staying in areas that are already struggling with poverty and perpetuating all these issues. So, and you are so right, we will not meet many of these NZD goals, which was also caused by COVID, because a lot of the resources that went into these pathways of certain NZDs, the funding was stopped, or it was reallocated, because we are always focusing on the fire that is hottest that we need to put out, unfortunately. So, but what you're saying, I think there are a lot of good reports now coming up on One Health case studies. So, for example, I can talk on behalf of my colleagues. We're working on one, for example, Taenia solium. There's a lot of schistosomiasis programs, as you said, and praziquantel also treats the pork tapeworm that I mentioned, for example. But if you are only targeting humans and not treating the animals, then you keep perpetuating the cycle. So we're trying to work with the communities that we're not only giving out the drugs to school children, but we are also targeting households, that you don't have latrines or that keep pigs. So we are tackling the problem from both the animal side and the human side. And I think you gave the other good example of trypanosomiasis. I think trypanosomiasis is such a great example of how they really brought that terrible disease to a halt with an integrated One Health approach, because they worked on tsetse fly control, they worked on trypanosomiasis control in animals, especially the cows, of course, and they worked on good surveillance and control in humans. So human African trypanosomiasis is almost gone, which is great, especially the rhodesiense, the acute form. I think there's still some gambiense, but in animals, we're still struggling because we're not getting the same resources as the humans. So I think for any of these NZDs, because most of them are zoonotic, you really need to have a community-based approach. and not only look at the humans or the animals, but look at the village ecosystem or the county ecosystem, and then try and identify this is our most important problem, and this is how we can solve it by bringing the different disciplines on board. Yeah, so if you want, you can email me, and then I can share also publications from our NZD group. We're also working on those. Yes.
Sure. That would be great, because that is my area and I'm very passionate about it.
Yes, thank you for being passionate about it, because it doesn't get a lot of attention. It's not Ebola.
Or COVID.
Or COVID, yes.
Okay. Yeah. Thank you very much.
Thank you too.
Thank you for answering those questions. Oh, the lights go out. Thank you for answering those questions, Christina. I want to thank both you and Katarina for giving a talk and answering the questions of the cohort, and hopefully diving into those topics more deeply, and broadening their knowledge on these things. So thank you. And I will share your emails and the slides if that's okay, and then people can get back to those if they need more information.
Thank you.
So thanks a lot.
Perhaps, Michu, you could also share like the chat with us. Just to go through the questions. Thank you.
That's a good one. Thank you. So just to wrap the session up a bit, of course, there's some delay, as with online events. We have a short feedback session scheduled. I will really keep this tight now to also let you go about your day or evening. I was just curious, I think on the bar you can see the poll. And I'm just curious if you would like to have more lecture-based or interaction-based events. I will maybe also share this in a WhatsApp group to get a more broad overview of the whole cohort, to see what kind of events you would like. So we can also discuss this later. Let me see in the chat. Oh, that's Katarina. And then in the meantime, I will also go further ahead, because so for the next event, we have it's scheduled on April the 25th. And this will be about interdisciplinary collaboration. And we will also provide you with a schedule soon of all the upcoming events, so that it's more ahead, because of course this was a bit last minute. So I really want to thank everyone who made time to be here and was present and interacting with the speakers. And thanks a lot for that. So let's go to the next. I was wondering if there are any other questions from the cohort about the events or anything else about future webinars or other events. I will share the documents. I will double check with the speakers, and then we will share the information. Thanks. I see that I now have one vote for lecture-based. I will, it's half now. I'll make sure to also share the poll in the WhatsApp group to get a broad overview of that. So thanks. And without further ado, I think that's it. Thanks a lot, and hope to see you next time. Have a nice day. Bye-bye.
Bye.